Hey, it's Dr. Bill with just the tip of urology school. Uh, this video is going to tackle some concerns with Foley catheter problems, whether the catheter is not draining, maybe malpositioned, or you just can't get a new catheter in. It's actually a quick read. There's some nice videos associated with this, so I encourage everyone who will be taking emergency room call and being involved in our clinic with both men and women who may be in retention. It's some good information. Remember, when you do get called, you're called because you're experts, so don't freak out. Figure it out. You always have backup with one of the physicians who are on call with you. Remember that it's important not to be stingy with the lubricant. A lot of nursing staff will hand you a Foley catheter and have a small dab of lubricant on a sterile field. Take 5 to 10 cc syringe of either KY jelly or pre-packaged lidocaine lubricant, assuming no contraindications, and place it in the urethra and milk that urethra to make sure that the lubricant is in place. That works for both men and women. When you use this technique, understand that the catheter may not immediately drain because you've put an excess amount of the lubricant. So all you do is aspirate or irrigate that extra lubricant out of the lumen of the catheter. Additionally, a lot of people will knee jerk and go to a smaller caliber catheter if there's initial difficulty. Sometimes using a one-up size, 14 to 16 or 16 to 18 French will help because it's stiffer. And so it will allow to gently prod through any obstruction. When you're using a Coude catheter, be mindful of the fact that the tip or the curvature should be headed north towards the ceiling. One good way of monitoring that is to make sure that the small arm of the catheter that you inflate the balloon is pointing in that same direction, northward or towards the ceiling. Otherwise, it's going to be a little more difficult to get appropriate catheter placement. These are some interesting tips. Understand that at some point it's okay to give up. You can use interventional radiology if you have those available. That team is excellent in placing transurethral catheters with retrograde urethrograms and assisting through imaging and placing a suprapubic catheter. If they're not available and you're really in trouble, it is okay to aspirate suprapubically with a long spinal needle. That will give you some time. There are a lot of tricks. Don't freak out. Look at the video and listen to the guys who've been here before. Dr. Bill, just the tip of urology school.